Welcome to Perimenopower with Dr. Lauren Ward-Selinger, naturopathic physician and Menopause Society certified practitioner, focusing on integrative health support for perimenopause and beyond, bringing you applicable tools and information to help you on your journey. Enjoy the ride that we will share here on Perimenopower. Hello, and welcome to the Perimenopower Podcast. I'm your host, Dr. Lauren Ward-Selinger. I'm a naturopathic physician in Bend, Oregon. And today, I'm very excited to introduce you to two of my favorite colleagues. So we have Beth Buchanan, who is from Well Nourished. She is a board-certified holistic nutritionist. We'll hear more about what she does. And then we have Melissa Keene, who is a licensed acupuncturist and doctor of Chinese medicine here in Bend as well. And her practice is called Tree of Life Acupuncture. Us three together started the Perimenoposse, which is a local support group here in Bend for the perimenopausal and menopausal population. And we get together once a month and have an educational subject and just kind of talk to people and swap stories and information. And it's just been such a hit. But one of the reasons that we were inspired to start recording this and sharing it with you all was because it's just really hard to get everybody in the room on an evening, especially when our population that we're working with is a lot of working moms or just people who work or are busy doing fun stuff here because they live in Bend. So anyways, without further ado, we'll move on. So Beth, please tell us a little bit about your practice and what you specialize in.
Okay, Beth Buchanan. My practice is called Well Nourished, and I specialize in female hormonal health, but I really love the perimenopause, menopause population, in addition to digestive wellness and then metabolic support, and they all really kind of go together. But I am a deeply food first and lifestyle first practitioner, so we're always going to really look at the food, the timing, the nervous system support, what's really happening with the absolute foundation of health, which really would be food and movement. And then from there, if we need supplements or if we need testing, we can kind of add all of that in. But yeah, my favorite population is really perimenopause, and then just the amount of support that really goes into this phase of life is just really impactful. So we can move that needle really, really well with food and lifestyle, which is really empowering.
Great. Can't wait to hear more. Melissa, tell us about your practice.
Yes, hi, I'm Melissa Keene with the Tree of Life Acupuncture, and I've been here in Bend for almost 4 years. I've been an acupuncturist for almost 20. And my specialty is major life transitions, and I've been a doula for both a death doula and a postpartum doula and a birth doula for almost 15 years. And I really love this population as well, talking to perimenopause, menopausal women and their families and their loved ones. I think everyone can benefit from learning more about this time of life. And I love reframing it. And I think we can go down sort of like a little black hole sometimes of oh my gosh, it's the worst. But I think it's a fabulous time in life. And I really love talking about that aspect of it and bringing light to it.
Yeah, love it.
I can't wait to hear more about that. I mean, we've talked about this in the past, and I find that, Melissa, you bring such a beautiful story with this transition of perimenopause and menopause, where in the Western mainstream world, it's like this doom and gloom. Oh no, my days are numbered. I'm getting old.
I'm falling apart.
I'm falling apart. Yeah. And it's, yes, okay, that can be true. And it can also be a really beautiful transition time where we really harness our power and what's important to us and prioritize what we're really doing here, right? This era of really owning it.
Yeah. And shifting into this next chapter and how much power and kind of new light comes with this next chapter, which is really magical.
Absolutely.
Yeah. So can you tell us from a Eastern perspective, what does this perimenopause and menopausal transition really mean?
I think that it's a really great time, especially in our Western culture, to look at it. And I think Western culture tends to prioritize beauty and staying young, and it puts a lot of fear into a lot of us about aging. Chinese medicine, I mean, certainly there's an aspect of that in Chinese medicine as well, but their culture really reveres aging and the wisdom that comes with it, and they they hold space for folks in that time of their life, even beyond perimenopause, menopause, and into old age. I think that looking at ourselves and really owning who we are and letting go of the stories that we were brought up with and that we held on to for a long time. And our main drive earlier in life is reproduction and following a script. And I think we can let that sort of fall away and really look at ourselves and decide what we really want to do for the second half of our life. And now that we live so much longer, it's really curious because we're not going to die in a decade or 2 decades or 3 or 4 even sometimes. So I think there's a lot of discussion to be had around this time of life and how to harness it and make the best of it.
Yeah, and that perspective shift. Yeah.
I love that. And that is, one of the reasons why I named this Perimenopower is because, well, it's a great play on words, but also I do think that this is a really empowering stage. We're headed into this next chapter of life where we can really do what we want to do, really shed some of that skin of that uncertainty of youth and just embrace it and just, go after it and enjoy it. And for a lot of people, this age group, they have maybe aging parents, they have aging family members, they have kids leaving the nest. Like, it's this time of a lot of really massive shifts in family dynamics too, which can be really freeing. And then it is really interesting. So in the past 100 years, the average life expectancy of humans has gone up tremendously, like you mentioned. So the average age of death 100 years ago was 55. Now,
that's insane.
Now,
Wasn't that long ago.
the average is 75, 78, somewhere around there. And so just in a very short 2 generations, basically, we have extended our life expectancy so much longer. But what hasn't changed is the average age of menopause.
Right.
Yeah.
So the average age of menopause is between basically 45 and 55 is kind of typical, and 51 is the average age. So if you think about that, like previously, 2 generations ago, people would go through menopause and then they would die within 5 or 10 years. And so the postmenopause era was not much to be had.
Yeah.
Right.
And then those health risks of being in a hormonally deprived state were also different, right? Because we didn't live that long. So, and of course, with averages and numbers, there's always outliers, right? There's the people that died way younger and the people who lived way longer. We all have that like one relative who lived to be 102 or whatever. And so that's always going to be there, but the averages are the average. And so I just find that really interesting because now a woman goes through menopause, let's say 50, and then lives to be 80. That's 30 years, right? That's such a long time to be in a hormonally deprived state, first of all, but also such a long time to be in this era of, wow, child rearing is not my main goal. And I am established in my career, or I've retired, or it's a time that's just for you.
Yeah.
So how do we prepare people to go into that era and feel good? And how do we get people through this transition that could be for some people very, very easy and very smooth. And for some people just like a complete roller coaster that is just a disaster. The wheels are falling off. So how do we help them through that? So that's our kind of main goal here. Like all of us as practitioners, how do we support these women to feel their best and get all the things done they want to do and rest when they can rest and all of that? One of the things that we decided we wanted to talk about today was just what are our main tools that we like to provide to people? What is the main take home? If I could give you 2 things to go home and do today, what would they be? So, Beth, let's start with you.
Okay. So, if any of you know me, it's blood sugar. So, hands down, number 1, the very foundation of what I work with everybody on is blood sugar, stable blood sugar, resilient blood sugar. And that really sets the stage for adrenal health, for liver health, for hormone health, thyroid health. It's just across the board. So, really foundational thoughts around like metabolic flexibility. Does my body know what to do if an apple shows up, which is mostly glucose, versus an avocado, which would be mostly fat, and its ability to kind of switch between using different fuels. And most of us, if we're kind of just out there living, not necessarily standard American diet, because I feel like a lot of my clients are actually quite healthy, we just have some lifestyle and timing issues, is really how are we paying attention to circadian rhythm and what we're eating, what's happening at breakfast, what's happening at lunch, what's happening at dinner, what's actually on my plate as far as, are we getting enough protein? Are we getting enough fiber? If we're having coffee, is that coming with a good fat source? Because that's really helps to dampen the caffeine conversation with adrenal glands first thing in the morning. So really, the ripples are very wide and very deep when we talk about blood sugar and how that supports this stage of life. But hands down, it's the first thing we're going to do. So some easy takeaways would be 30 grams of protein per meal, ideally. And that's kind of where I start most women, depending on what they're doing. If they're really active, I might change that a little bit. But studies show that the older we get, the more protein we actually need. But I find it to be the opposite when people come to me. They are eating less and less as they age. And maybe some of it is digestion and they just don't feel like they're digesting it well. So then we have to back up a step, really work on digestion, but continue to get those raw building blocks that we need for hormone support, for immune system support, for detoxification. So 30 grams of protein per meal would be ideal. 3 regular meals would also be ideal. And our body really loves consistency. Like, it really wants to know that I'm getting breakfast about at the same time every day. Lunch is coming at the same time. Dinner's coming at the same time. And we're not skipping meals. That's not a thing we get to do. If there's insulin resistance involved, that's a little bit of a different conversation. But for the most part, protein, really consistent timing, and ideally caffeine doesn't show up first thing on an empty stomach. Those are like easy. You could go home and do those today. Should I go to my second thing or wait?
Can I ask you a question?
Yeah.
So is this across the board for everybody that doesn't even have problems on their labs, you know?
Yeah.
Okay, because a lot of people come in and be like, oh, but my blood sugar is normal.
Yeah. So this is so great because in the conventional world, we maybe look at A1C and maybe fasting glucose, right? I really want to know what's happening with insulin, maybe even C-peptide, because that gives me like a deeper look into insulin handling. Then we have one of my favorites, it's GlycoMark, and that's looking at something called first phase insulin response. And that is telling us, again, how well are we handling the insulin? Are we producing enough? Are we getting an appropriate response of insulin, which is, of course, insulin's helping getting glucose into the cell so we can turn it into energy. And then is it also coming back down to fasting levels between meals? And if not, right, if it's too high, then we have to talk about like insulin resistance. Are our cells appropriately signaling, listening, hearing signals from insulin? So there's kind of few different pathways. Do we have like hypoglycemic patterns where we kind of have these like up and down, or is it more of an insulin resistance pathway where maybe we're riding pretty high? Either way, you got to deal with it and support it. But 30 grams of protein is really fantastic no matter what. The coffee thing is a non-negotiable for me on how we're supporting adrenal glands and blood sugar. And then just a super consistent meal timing.
Awesome. Love that.
That's my favorite.
Yeah.
Easy.
What's your second?
Oh, my second is stress. Stress is absolutely clean when it comes to hormone support. And stress will directly impact blood sugar regulation. So they will go hand in hand. But we are in a time where we're like, we can't say no. I got to get my kids to places. I got to feed everybody. Like I have to. I run my own business, all the things. I cannot necessarily say no to more things, but I have to figure out a space where I'm responding differently to stress. So it is making sure I'm doing my self-care, which is maybe meditation. Maybe it's just breathing if I don't have time, right? If the day is just crazy. But it is also a non-negotiable, and that a day really shouldn't go by where I don't at least get 3 minutes of paying attention to my nervous system and taking a few deep breaths or having a moment of gratitude. But stress resilience and happy hormones go hand in hand. And then I was also looking at this other, I can't remember who it was, but it was really fantastic, where some of us are more resilient to stress just naturally. Fine, great. Mm-hmm. However, that load still adds up and will ultimately lead to kind of a breakdown farther down the path. So even if I am a person that's like, oh, it doesn't bug me, I still shouldn't be taking on the weight of the world just because it doesn't bug me. It will catch up. So we have to have a balance in the amount of things we put on our plate and the amount of things we're able to like truly say no to and create space for our nervous system.
Love that. And 3 minutes a day does not seem like a big ask.
No, right? Truly. Anybody has 3 minutes. Even
Does it
if
have
it's
to be
before bed.
Does it have to be 3 minutes in a row, or can you do 1 minute?
That's a good question. I'm all about like negotiate with me. Like let's make this work for you. Give me some options.
Somewhere.
Yeah, start somewhere. And also that means there's really no excuse, right?
Exactly.
Like you can do something.
Exactly. Yeah.
Great. I love that.
Absolutely.
What about you, Melissa? What are your kind of favorite go-tos? Like if you have a new perimenopausal woman come in and she's struggling.
Same as Beth, I think stress is huge, and I've been studying it a lot lately, and it affects every aspect of our life, and especially at this time in our life. Stress can show up in so many ways. Like you mentioned earlier, a shift of the family unit. Maybe you have aging parents or you have kids that are moving out, lots of changes. Some folks don't deal super well with change. So I think looking at the areas of your life that are causing the most amount of stress, really sit and listen to the person. I want to get their story, see where maybe we could help with stress. Obviously, I'm biased, and I think acupuncture is a great way to deal with stress. And if you could come in weekly, that'd be awesome. I get that you can't do that all the time, but like Beth said, 3 minutes a day, checking in with yourself. I remember when I was postpartum, I told myself if I got one thing done a day, I called the day a success. And you know what? I don't know why that is only for postpartum. I think it should be for every day, the rest of our lives. We're so bombarded. It is just crazy how much
The expectations.
Yeah, the expectations, the gadget that we look at for 5 hours a day, minimum usually.
Yeah.
That's the average. I think even trying to not look in front of a screen. And that's obviously not Chinese medicine. There are herbs, there's practices like Tai Chi and Qigong. They're very much a huge part of Chinese medicine. Nutrition is also a big part of it. And I think fulfillment, another little aspect. One of my teachers in school said most practitioners miss this part, is asking the person what nourishes them, and do they have a hobby, and is there something that just like lights them up. And if you don't have that, then you're not going to be healthy. Your life it's going to be a lot harder if you don't have something to look forward to.
Missing a crucial piece of what gets you out of bed in the morning and how you are content or joyful or
So I'd say get a hobby.
Yeah.
And put away the screens. And when you can, get acupuncture, do the breath work, meditate, whatever you like doing the most. You're going to do it more often if you enjoy it. So,
Love that.
adding in some fun.
Yeah.
What are your two?
Well, it's funny. So my first one was going to say supporting the adrenals, which really goes hand in hand with this whole stress discussion. So oddly enough, we're all choosing the same thing as our number one. But so stress and adrenal function. So adrenals are a little bit more of a naturopathic and functional medicine thing. Obviously, conventional doctors recognize that there are adrenals. But if you were to go talk about like adrenal stress and adrenal dysfunction, it kind of gets a little too woo-woo for them. So I would say if you're interested in learning more about that, seeing a more holistic practitioner is probably to your benefit. So we know that the adrenals, you can test for adrenal failure and adrenal overproduction and like a tumor. And in the conventional world, that's kind of what you look at is like, is it one or the other? Anything in the middle is normal. Well, I'm a little bit more nuanced than that. So I don't really feel like just because it's in the middle, it's normal. So, and then thinking about what does it really mean? So your adrenal glands, they regulate your sleep-wake rhythm, your cortisol. So you know when to wake up and you feel rested in the morning and you feel energized, and you know when to turn it down and go to sleep and sleep deeply, right? Those are your adrenals doing that. They also produce the hormones for your fight or flight pathways. And if you think back to generations ago, thousands of years ago, right? We were running from a bear. We were running from a saber-toothed tiger. We were on the verge of famine, whatever. There were these things that stressed us, but they were usually somewhat concrete and like in a box. And they were this moment in time. Whereas now it's all day long. We're inundated with the phone calls and the texts, and we're driving super fast on the highway and the radio's on, and you're trying to get 12 errands done and get all the Christmas presents and whatever. You're trying to just get all these things done. And the way our bodies really interpret that is you're running from a bear all the time, like constantly. So there's going to be repercussions to that, right? You're not going to feel your best. You're not going to have your best energy. You're not going to sleep as well at night, potentially not digest your food as well, because if you're running from a bear, your body doesn't really care if you have stomach acid, right? That's going to turn off. So just on a very, very basic, like digestive function level, the adrenals are really just going to control everything. And so I think that's an important reflection. And if you are having maybe digestive problems going along with this whole hormonal stuff, that could be one of the reasons. I think maybe you're stressed and your body thinks you're running from a bear, and let's turn that off, right? Let's have that parasympathetic nervous system. And so for people who are like have scientific background, there's the fight or flight and rest and digest. Those are the two pathways that your nervous system can be in. There's really no in between, right? You are one or the other. So think about that. Yeah. If you're running from a bear, you're not resting and digesting.
Yeah.
So I just think that's a really cool thing to think about. I love treating the adrenals with herbs, and there are beautiful herbs that most people do well on, adaptogenic herbs, and even things like mushrooms and stuff. I think finding a adrenal formula that works well for you is huge, and you might have to try a couple before you find one that you love. I also really like a glandular adrenal, which is bovine adrenal. So it's adrenals from cows, and they're dried and then they're ground up and they're measured and they're put into a little capsule or tablet. And it's kind of gross, but it works really well. I find that it works really well to fill up the little wells in the background that you're giving from constantly with all of this outward energy. And if you think back to a couple generations ago when we had our own animals and we would slaughter them and we would eat the whole animal, right? That included the brain and the kidneys and the adrenals and the heart. And we don't really do that anymore as a culture. I mean, in an American culture, unless you maybe are a family of butchers, which good job if you're doing that. But anyways, so to kind of bring us back to this ancient wisdom and the fact that our ancestors would have practices like that, maybe there was some benefit to that we're kind of missing today. And so I would say adrenals are my number one, especially for this population, that's this kind of stressed out, overworking, balancing, spinning 25 plates at once, kind of a picture that like a lot of this perimenopausal population is. And then I think my number two would be progesterone. And so anybody who listened to my last recording, I talked a little bit about it. 8 out of 10 times when I give progesterone to a woman who is showing signs of low progesterone, they come back a couple months later and they're like, you have saved my life. I can sleep. I can think. I am not snapping people's heads off. My anxiety is gone. It's just a total game changer. And it's really good odds that it would work for you. I do have some people who we have to compound it into a special capsule that's a really, really low dose because they're very, very sensitive, and giving them a full, normal, regular dose would knock them out for 3 days or something. And then there are a few people who have the opposite reaction and it makes them really awake and jittery. And so for those population, we'll have to maybe do something special or different. But like I said, 80% of the time, it's a win.
I do have a question.
Yeah.
I am not licensed, right? So I'm not doing any of the prescription or anything. But I have access to like topical bioidentical progesterone. Is there a place where you're like, when the lab is this low, that is no longer effective and we really need to look at a higher dosing in a pill form or whatever?
I would say if you ever were like, you know what, let's just try it with topical. Just try it and just see if it helps.
Okay.
You know, it's going to be the max dose per pump from an over-the-counter progesterone is 20 milligrams.
Okay, yeah.
Okay, so the starting dose of a pharmaceutical prescription that's oral is 100 milligrams. So you would need 5 pumps to be equal, which is a lot of cream.
That's a lot of cream.
It's a lot of cream. And financially not feasible.
I was going to say it gets very expensive very quickly.
Right. You would go through a bottle like every week and a half, you know? I mean, it would get crazy. But For my very sensitive people, 1 or 2 pumps, like that actually works really well for them. So especially in this perimenopause time period where someone's still cycling and they are still producing all the normal hormonal cycle hormones, like sometimes just a little bit of progesterone is enough
to like.
Exactly.
Yeah.
Yeah. So you don't have to slam someone with it. I like the analogy. I use it with my patients a lot. I'm like, some people need a chisel, like a fine chisel, and some people need a sledgehammer, and that is okay. You just have to figure out which one you are based on your response to things, what your labs look like, how severe your symptoms are, that kind of thing. So it's okay to have to try different methods. Okay. Yeah, we will continue to go over the hormonal side of things, of the labs, the prescriptions, the herbal support. That's going to be a common theme, I think, throughout all of these episodes of discussing that. But yeah, that's a great question. And so, some people, the topical is great. I will say, little asterisk disclaimer, that if someone's on estrogen, topical progesterone is usually not enough to protect their uterus. So we do need, estrogen can make the endometrial tissue grow, and progesterone can make it basically blunt the growth. If someone's on estrogen, then they usually need to be on a progesterone or progestin. And if someone's had hysterectomy, it's kind of optional. I personally like to give them both because I think most people feel better if they have both on board. But I guess that would be a place where if someone's on a little bit of estrogen and they're doing a topical progesterone, but they don't have a uterus and that works for them, that's a pretty safe combination. Yeah.
I remember you mentioning a while ago about the fact that never in your life is there just estrogen bodies. So for that purpose, I also think that progesterone would be helpful even if you don't have a uterus.
Absolutely. It does so much more than just regulating the uterine growth, the intrauterine growth. It's it relaxes your blood vessels and it's softening, right? It's a muscle relaxer. So I've had people who they've come to me and they've been on estrogen only therapy for years. And I'm like, you know what, let's get you on some progesterone. And their high blood pressure goes away.
Yeah.
That is not an uncommon thing to see because it's they had this thing that was pushing a lot of these pathways and it didn't have its little BFF to counteract.
To chill it out a little bit.
Exactly. So it's, I almost always use both together. Almost always. There's very rare exceptions. Yeah. But then, I think, again, anybody who listened last time, I went into a little spiral about testosterone too, and that would be tied for second place maybe because it is a really great tool. Also, I don't think every single person needs it, but if you have the symptoms of low testosterone and you have lab levels that show low testosterone and you're perimenopausal, let's try it. There's not a lot of downside to trying it. And for some people, it is just so crucial for giving them a libido and a zest for life and just getting rid of the little Eeyore cloud following them around, or just also that executive function piece of being able to multitask and critically think and make plans. And that can be so huge.
Cool. Love it.
Yeah. I think that it would be really fun to hear maybe if Melissa, if you want to talk a little bit about the Chinese medicine side of things and also maybe even your doctorate program that you're doing.
Yeah, cool.
Oh, I love your association with the season.
Yeah, that's cool. And this, was it a 7-year thing or a 9-year thing?
Yes.
Yeah, 7. Well, for women, it's 7, men, it's 8.
Yeah, tell us about that.
All right. In Chinese medicine, they have this idea that a woman's or a female's life is set up in every 7 years cycle. For men, it's 8 years. But we're talking about women primarily here, so we'll go into that. If you look at it, the first 7 years is childhood, 7 to 14 is onset of puberty. I think it used to start a little bit later back in the day. And so hopefully we don't get to the point where the first cycle is also puberty. It sort of seems like that's happening a little bit. But anyway, so 0 to 7, 7 to 14, 14 to 21, that would be back in the day, again, prime reproductive time, even though we don't really like to talk about our 15-year-olds getting pregnant now, but it is kind of prime time in our female bodies to reproduce into mid-20s, I would say. And we're pushing that out more and more. So I think folks a lot of times are also reproducing and then going straight into perimenopause.
Yeah.
So that's kind of a new thing too. But within Chinese medicine, there are these very definitive parts of your life. And the time for perimenopause is really, it's called second spring. And I love that. And it's like a return to self. So you went through your childhood, and again, sort of were within a family unit, and you learned the way that your family operates, and then you come into your own a little bit within puberty, and then you reproduce, and then it's another time for you after that. So I think that's a really neat way to look at our lives. And in Chinese medicine, they also have herbal formulas for every stage of our lives. And in Asia, most women are on a very famous formula, and it's called Liu Wei Di Huang Guan. And it helps support the blood and the liver and the kidneys, all the major organs. I could go into the organs in Chinese medicine. Some are male and some are female, like yin or yang. It's really interesting. And so this formula really nourishes all of the yin organs, which are the more female organs.
What are a couple of the female organs?
Let's see. So the female organs versus the male organs, like heart is female, liver is female, spleen is female, and then kidneys, we have two of them. So you have one male more predominantly and more female. And the formula that I mentioned does something for all of those organs. And so heart in Chinese medicine really can affect your sleep, your blood production, being kind of tired in midday or having a hard time falling asleep or waking up often. That can be related to the heart. Also liver. Liver corresponds to springtime and anger, the color green. And a lot of us in this culture, I find, are kind of compressed in their liver. They're like, it's looking at it in the Western realm too. It's like we do detoxes. The hormones can sometimes slow down the liver. It's similar in Chinese medicine too, but we call it stagnation. So I see liver qi stagnation all of the time. And it can cause irritability. It can cause just like extra stress in your life. So I really look at the liver a lot. And almost everyone gets that point between their big toe and their second toe, which is really
what you're doing on me.
And the kidneys, again, correspond with the adrenals. And Chinese medicine uses a lot of bovine or porcine parts to help nourish the adrenals as well. Like they've been doing that for a long time. Of course, everyone's also heard of the other animals that we no longer use and are not in the formulas that I dispense. But I think following that 7-year cycle and kind of expecting like certain things to happen within that time frame can be really beneficial, and you can set yourself up for success and even for the rest of your life. So if you take care of yourself throughout these cycles, then you're going to have a much easier menopause and old age.
Cool.
Yeah. And so stress is another big topic. And I've been studying the past year, getting my doctorate. And the primary focus has been stress at midlife and how it affects women. And it affects every part of you.
Yeah.
Man, what a valuable doctorate.
Yes, it's been great.
Very cool.
It's been a lot, and it's been really fun.
Even better to have behind you.
I think another big takeaway I gleaned from my studies is how you talk to yourself. So many of us, I get someone in the room and they start talking and they're just so hard on themselves. Like, I should do this. And I hate that about myself. And I really think that it'd be advantageous if we looked at how we spoke to ourselves and just framed it like I was talking to one of you.
You'd never say those things
Yeah,
to
you
a
would
friend.
never. And expect the best. Visualize what you want in your life. Have just a positive outlook and see what changes in your life.
Yeah. Did you guys hear about this? Harvard just put out a study not that long ago, and I'm going to get some of the details wrong, but it was basically about how we talk to ourselves and inflammatory factors. And it was only like a 2-week study, which is insanely short, right?
I saw that.
And inflammatory factors, and I think it was like interleukin-6 and tumor necrosis factor alpha, and they dropped like by 50% in 2 weeks. I mean, that is so in our control. Anybody can breathe. Anybody can talk to themselves kindly. Yeah, the amount of power and control we have from our brain to ourselves is greatly underutilized. Yeah.
Indeed.
Yeah.
Yeah. And that just brings up just like the mentality of manifesting what you want and having an abundance mindset and how powerful that can be.
Yeah.
Especially in midlife, right? Again, we're talking about people who are maybe mid-career or just re-entered the workforce or are gearing up for retirement or something. This is a time where that can become really important. Do I have enough? Am I making enough? Am I doing the things that are really, that's what I want to do to help the world or whatever? Do you have the right outlook going into all of that? So,
and it just fits so beautifully with this new chapter, and we really get to now embrace this place of like, who am I now and what does that look like and how do I want to contribute, not how do I need to because of roles we've had to play, chosen or not. This is truly a time of unveiling and creating a new story that doesn't have all the garbage, right? But you have to choose that, because the opposite side is, oh, I am getting older and things are falling apart and I'm no longer a valued member of my family or society and nobody listens to me and I'm outdated. That will equally work against you. So this is a big deal.
And we have to work hard against that. I feel like that is what we hear the most about. So.
That would be one of the main things people walk in the door saying is, I'm falling apart. My body's working against me. And that narrative, I work to change that narrative around like, it's changing and how do we support it versus working against what we think is going on.
Yeah. I love that. That could probably be a whole hour-long discussion.
Yeah, totally. Beyond.
How do we rewrite that story? How do we shift that?
Yeah. Great.
Well, I think we'll wrap it up, but I think this has just been such a fun introduction to you two.
Yeah.
I think we're going to do this many times with many subjects.
Yeah.
And I just can't say enough about working with both of you professionally and as a patient, a client of both of you. Yeah. I just absolutely love you both and your approaches. And it's just been an honor to sit and chat with you and share this information with the greater public. And I mentioned this last time too. This is a new thing. I love feedback, comments, questions. We are here for you. So bring us your questions, bring us your feedback. What do you want to know about? What do you want to hear more about? Did we touch on something today that was like, oh man, I could listen to more about that? We'd love to have that information, and we'll keep working on our setup too. This is a different setup than last time, and we'll keep perfecting it. So
thanks for providing the platform.
Yeah, you're welcome.
This is a big deal, and I wouldn't have done it. There's no way I would have started on my own. So go team.
Go team.
Yeah, and likewise, Lauren. I've sent so many people your way, and you're a fabulous provider, and you bring so much to our community. So
you're welcome. Thank you. Okay, we'll see you guys next time.